child contracted COVID-19. This is what happened to his heart. Katie is a 7-year-old Congolese boy presenting to the emergency room after 5 days of fever. A physical exam showed that Katie had swollen lymph nodes, a transient rash in his upper limbs, vomiting, abdominal pain, diarrhea, and stiffness in his neck. After a few hours after admission, he had signs of shock, low blood pressure, and a heart rate of 140 beats per minute. After being put on an IV, Katie was transferred to the pediatric intensive care unit. An echocardiogram indicated that his pericardium and heart were swollen and weak, so he was put on mechanical ventilation. The blood test showed that he had a low white blood cell count. His red blood cells were myocytic, meaning that they were smaller than usual. He had thrombocytopenia, meaning that he had a low blood platelet count. Hyponatremia, meaning a low sodium presence in blood, and was anemic. He also had high levels of troponin I, causing hypokinesia, or decreased contraction of the heart muscles. Hypo meaning under or decreased, kinesia meaning muscle movements. Normally, in your muscle fibers, there is a thick and thin filament called myosin and actin respectively that bind to each other and create contractions. In order to bind, myosin is supposed to attach to the thin filament cross-bridge binding sites, and there are also tropomyosin strands that block these sites. To expose the binding sites, calcium ions bind onto the troponin, which pulls the tropomyosin away, allowing for myosin head attachment. Troponin I inhibits the myosin from binding, which stops the cross-bridge from happening and prevents a relaxed muscle from contracting, explaining his weak heart. An abdominal CT scan suggested that Katie had COVID-19, which was confirmed by a nasopharyngeal RT-PCR test. This finding brought much confusion to the medical personnel working on this case because at the time, it was known that children were unlikely to develop severe symptoms upon contracting COVID-19. Yet, Katie's symptoms were clearly severe. The next day, doctors discovered that Katie had developed cracked lips and pink eye. Upon closer examination of his oral cavity, they could see that his tongue was swollen, bright red, and bumpy, signs of strawberry tongue. Because of this, doctors suspected Kawasaki disease, or a Kawasaki-like disease. Kawasaki disease is a vasculitis, a disease that involves the inflammation of the blood vessels that is common in children under 5. The disease is responsible for shock in 7% of patients and is the first cause of acquired heart disease in children in first world countries. During the COVID-19 pandemic, there were also multiple cases similar to this one, where patients developed severe Kawasaki disease-like illness and suffered myocarditis, the inflammation of the heart muscle, and shock after recent SARS-CoV-2 infection. Compared to regular Kawasaki disease, the Kawasaki disease-like illness related to SARS-CoV-2 tends to occur more frequently in older-aged children and adolescents of sub-Saharan African ancestry. Its distinctive symptoms include gastrointestinal involvement, myocarditis, shock, high levels of inflammatory markers, and a lower white blood cell count. Because KD had developed IgG antibodies in his system to fight the SARS-CoV-2 virus, one theory for the pathophysiology of this illness suggests that it was caused by a potent post-viral immunological reaction. Doctors administered immunoglobulins, which are antibodies that help reduce inflammation, through an IV to help treat KD's symptoms. After 8 days of hospitalization, KD's troponin I levels dipped back down thanks to the administered immunoglobulins and was sent home with a full recovery. Thanks for watching. Remember to wash your hands, wear a mask, and stay safe.